Alzheimer's disease is a medical condition characterized by memory loss, dementia, and a general decline in cognitive function due to the death of brain cells over time. Alzheimer's is a neurological disease and the most common type of dementia. Alzheimer's is a neurological disease and the most common type of dementia. People with the disease have beta amyloid plaques in the brain. The disease, which manifests itself only with simple forgetfulness in the initial stage, can progress over time to the point that the patient forgets the events of the recent past and cannot recognize family members and their immediate surroundings. In more advanced stages of the disease, patients have difficulty meeting their basic needs and become dependent on care.
If you want to get information on other important issues related to healthy and long life, you can like the video and subscribe to the channel. Thank you for watching.
Alzheimer's is a common type of dementia, a progressive neurological disease that causes the destruction of brain cells. It causes a decline in thinking, memory, and behavioral functions, and symptoms appear gradually with age. It can take years for the disease to reach advanced stages, as it is a progressive disease. Early symptoms of Alzheimer's are usually seen in the form of forgetting recent events, but within a few years, individuals may have difficulty performing daily activities on their own. Social skills, behavior, and the ability to think logically are also negatively affected over time. Patients with advanced Alzheimer's often lose the ability to converse with another person and have difficulty responding to questions and events that occur around them. Although the disease mostly affects people aged 65 and over, it cannot be characterized as a disease of old age, as younger onset cases are also frequently encountered. Alzheimer's patients usually present to clinics with complaints of decreased performance in cognitive and behavioral areas. Although the symptoms of the initial stage of the disease are milder, they are more pronounced in advanced patients. Symptoms of the onset of Alzheimer's are usually minor memory problems, but include symptoms such as forgetting recent conversations and events, and not being able to remember the names of people, objects, and places. As the disease progresses further, the most common Alzheimer's symptoms include blurred consciousness, difficulty in adapting to one's environment, getting lost in places one knows well, problems with speech and language skills, development of personality disorders such as aggression, unusual demands from family and friends, suspicion of the environment, hallucinations and delusions, low motivation and low self-esteem, difficulty in performing daily activities without assistance, denial of events that the person cannot remember, anxiety and depression. The above symptoms are usually present when the disease is first diagnosed. As the disease progresses, these symptoms increase in severity and become much more severe, such as the inability to recognize family members, complete forgetfulness of the recent past, and difficulty recognizing even oneself. Patients are often dependent on a caregiver for their daily lives' income. Although Alzheimer's is a disease that has been the subject of scientific research for many years, the cause of the development of the disease has not yet been definitively determined. However, the possible causes that are considered as risk factors in the emergence of the disease, in other words, which are emphasized to play a role in the development of the disease, are as follows: advanced age, family history of Alzheimer's disease, having Down syndrome, past head traumas, disorders of sleep patterns, inadequate physical activity, obesity, smoking or continuous exposure to cigarette smoke, high blood pressure and high cholesterol, having poorly controlled type 2 diabetes, inadequate and balanced and unhealthy nutrition. Studies investigating the prevalence of Alzheimer's disease in two different genders show that the prevalence of Alzheimer's disease in the female gender is slightly higher than in the male gender. However, there is a possibility that this may be related to the higher life expectancy in women. In addition to the above reasons, which are considered risk factors for the development of the disease, Brain tissue examinations of Alzheimer's patients reveal beta amyloid plaques around dying brain cells. Studies aimed at investigating the factors that may cause these formations and the death of brain cells in patients offer a glimmer of hope for determining the exact cause of the disease in the future. Default people who experience symptoms indicating Alzheimer's disease should immediately consult a health institution. In patients diagnosed with Alzheimer's disease, as a result of the evaluations to be made by the physician, the treatment process is planned individually, taking into account the patient's age, the level of progression of the disease, and other accompanying diseases. There is no known definitive treatment method for Alzheimer's disease, however. It is possible to reduce or eliminate the symptoms of the disease and slow down the progression of the disease with some applications. Necessary arrangements should be made in the home environment of Alzheimer's patients, and measures should be taken to prevent forgetfulness and facilitate recall at home, especially for patients who have to live alone. These can be notes to be posted in certain parts of the house, or attention-grabbing signs. Psychiatric therapies, such as cognitive stimulation therapies, which can be administered individually or collectively, can help to improve memory and preserve problem-solving and language skills. A number of medications may be recommended by the physician to reduce symptoms and improve quality of life. Cholinesterase inhibitors such as donepezil, rivastigmine, Tacmin, and memantine are the most commonly used drugs for this purpose. These drugs are not a direct treatment tool for the disease, but can be considered as part of symptomatic treatment in individuals with a family history of Alzheimer's disease, but who have not yet been diagnosed with the disease. Measures can only be taken to eliminate risk factors, since the exact cause of the disease is unknown. These include avoiding smoking, adopting an active lifestyle, and eating a healthy diet. In addition, these individuals should be made aware of Alzheimer's disease and the symptoms that indicate the disease. If you or someone close to you is experiencing symptoms of Alzheimer's disease, such as memory problems, you should immediately consult a healthcare provider and undergo an examination and the necessary diagnostic tests to investigate the disease. If the disease is diagnosed, you can significantly slow down the progression of the disease by starting the treatment process as soon as possible. We wish everyone a happy and healthy life. Thank you for watching.
You can support us by liking the video, writing your thoughts on the subject in the comments, and subscribing to the channel for the development of the channel and more such content.